Welcome to Eye to Eye. I'm Jan van Meurs. Today I'm talking with Dr. Michelle Callegan about new approaches to treating endophthalmitis. We just finished a symposium on endophthalmitis, and that is one of the reasons why we're here. First question to Michelle would be, endophthalmitis is rare, but it continues to be one of the things that worries clinicians most, because you do a procedure and you end up with potentially pure disaster. It is in fact the most severe complication of surgery. Please, Michelle, tell us about your research into the underlying pathology of endophthalmitis.
Well, endophthalmitis is, as we learned in the symposium, a multifactorial infection. And by multifactorial, I mean that there are important aspects about the organisms that cause endophthalmitis. Not only that, but also the host. The inflammatory response to endophthalmitis can be as detrimental as infection with the organisms themselves. So for the past 20 years, my lab's been involved in looking at bacterial aspects of endophthalmitis as well as host aspects of endophthalmitis. Currently, therapeutics for endophthalmitis include antibiotics and corticosteroids, which are supposed to limit inflammation and kill the bacteria. However, there are certain aspects of both the bacteria and the host that these therapeutics don't touch. Namely, organisms or bacteria that are antibiotic resistant. That's a big problem globally, and it's no different in ocular infections. Inflammation can be very robust, and corticosteroids activate, or they work on a part of neutrophil biology that is very narrow, and so anti-inflammatory treatment with steroids doesn't always work. And in terms of bacterial products that can damage retinal cells and limit retinal function and also cause inflammation, antibiotics and steroids don't address those aspects either. So our lab for the past few decades has been focusing on those aspects of endophthalmitis in the biology of the bacteria and the host that we could try and target for improvements in therapy.
Would you give me some examples? Because I remember from the symposium there were some very attractive targets.
Mm-hmm. So based on inflammation, so depending on the virulence of the organism may produce one or more toxins. And as I said just previously, bacterial toxins are something that antibiotics and anti-inflammatories just simply don't address. And so we published in 2 papers, one most recently in March, that use of a nanotherapeutic nanoparticle called the nanosponge in conjunction with our collaborators at University of California, San Diego, have been testing these nanosponges for treatment of experimental endophthalmitis in mice. Now, we haven't just been looking at one organism, we've been looking at some of the major players in endophthalmitis, including Staphylococcus aureus, Enterococcus faecalis, Streptococcus pneumoniae, and Bacillus cereus. Those are the major gram-positive organisms which cause severe cases of endophthalmitis. And those organisms produce toxins specifically in the family called pore-forming toxins, and those toxins do exactly what the name says. They form pores in cells, which can be very detrimental to the retina and can be very detrimental to neutrophils that come into the eye in order to eliminate the bacteria, rendering them useless. And so nanosponges specifically bind pore-forming toxins. Now, what we determined was that since bacterial endophthalmitis is a multifactorial infection, and these organisms some produce one pore-forming toxin, some produce more than one pore-forming toxin, and some produce one form of pore-forming toxin and multiple other types of toxins, that depending on the bug and depending on the number of toxins they produce, sometimes the nanosponges were beneficial, in treating the infections, and sometimes they weren't. And that was when in conjunction with antibiotic treatment. So the jury is still out on whether nanosponges will be useful for endophthalmitis. On the host side, we've also been looking at targeting the initial responses of the host to infection in terms of acute inflammation. And acute inflammation in endophthalmitis is driven by interactions between products of the host and receptors on the surface of retinal cells, and these receptors are called toll-like receptors, or TLRs. And there are two TLRs that are very important to bacterial endophthalmitis, TLR2 and TLR4. And we found in preliminary studies that if you can eliminate TLRs from the infection by use of genetic ablation of the TLRs in mice, that you can significantly limit inflammation. And so right now we're looking at using blockade of TLRs therapeutically as a way to limit inflammation in endophthalmitis.
Thanks. I remember there were many compounds and even avenues in experimental investigation. How far away are they from actual human use?
Probably quite far. So the experiments that I talked about in my talk in the symposium were all done in animal models, and it's quite a far cry from stretching that from animal models into human models. So I think we're quite far away, but at least now we know from looking at the pathogenesis of the disease at both the bacterial level and at the host level, we have targets that we can go after.
Thank you very much for that.
Mm-hmm.